We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we discuss the latest trending medical headlines and celebrity health news. Listen, I'm telling you, we have such an exciting show for you today. There has been so much medicine going on in the headlines and with celebrities and just with people who could really teach us all something about our health so that we can live our healthiest, happiest lives. We're going to start off talking about Nolan Wells because the preliminary results of the independent autopsy, well, those results have been revealed. And I had the honor of watching it live with Don Lemon on the Don Lemon show. And I gave my actual real-time immediate reaction right after the live. You can watch that right here on the Dr. Frita channel where I have a collaboration with Don Lemon. But I'll give us a chance to talk about it right here on Dr. Frita Live. We'll talk about the preliminary results. What does that mean? Preliminary autopsy versus final. We'll talk about the findings of this autopsy, the independent autopsy. Very importantly, we'll talk about the limitations and what it tells us. And then we'll talk about this still ongoing cyclospora outbreak that's causing explosive diarrhea due to cyclosporiasis. Even though RFK Jr. came to the front of the stage and said that we have it under control, the numbers are still growing. It's growing. We now have at least 11,500 confirmed and suspected cases of cyclosporiasis. So I'll let you know about what we know now about the latest possible contamination sources, and really importantly, what you need to do to be safe when you eat your produce. Then we'll play a game, because I really could use a game, myth versus fact. We're going to talk about Real Housewives of Orange County star Jeana Keough, 70 years old, because she had what she thought was an annoying tongue sore. She kept going to her dentist about it. Come to find out, she actually had oral cancer. She had tongue cancer, squamous cell carcinoma. So we'll talk about the warning signs and symptoms of oral cancer, when to see your doctor, and what can be done about it. And then I'll give you your second weekly dose of the latest trending medical headlines and celebrity health news. And we'll talk about someone, Nivea. I actually really, really like Nivea. I had the opportunity to meet her once when we were both on Sister Circle Live some years ago. Very warm person and a Grammy Award nominated artist, brilliant singer, and just a warm person, a kind person. Well, she shares that she has a diagnosis of leukemia. Yes, she was diagnosed with leukemia earlier this year. She's pretty young. She's in her early 40s. So she's not the typical person you would expect to get it. So I'll talk to you about how to find out if you have leukemia, warning signs and symptoms, risk factors, treatment, and we'll go into it. And I really appreciate her for being so transparent. And she's actually being very optimistic, rightfully so. Lastly, we'll talk about longevity. I'm talking to you about all these illnesses here and there, to the left and to the right, but let's talk about how to live long, high quality lives, like Arsenio Hall, who is now 70 years old. He has revealed some of his secrets for looking young and like he just still kind of got it all going on. And his secret actually might surprise you. But on a larger stage, we're just going to talk about some evidence-based medicine as far as ways that you can live a long life. And you might be shocked because the answer is not necessarily in all of these super expensive, treatments and supplements and pills that are being sold to you by a lot of wellness gurus. I'm going to give you some Harvard and some JAMA, some evidence-based medicine and facts when it comes to longevity. So you already hear it. We got a jam-packed show. We are live. So of course you'll be able to ask me questions, but don't play. I like to ask you questions too. Please go ahead and give us a like, a subscribe as we get started, because we're about to give you some evidence-based medical information with a little twist of fun. I'm Dr. Frita. This is Dr. Frita Live. Let's get this thing going. Hello. I'm Dr. Frita. This is Dr. Frita Live, where we discuss the latest trending medical headlines and celebrity health news. Please go ahead and give us a like as we get going. And I thank you for being here today. I'm not doing this thing alone. I'm not talking about all these topics about myself. Of course, I have my office manager and co-host, Miss Shador, with me. Shador, please come to the front of the stage. How you doing?
Good, Dr. Frita. How are you?
Doing well, doing well. How was your weekend?
It was good. Had a little water fun at one of the parks here in Georgia.
Oh,
Yeah.
let's see. You said you went to a park.
Yes, water park, water park.
Oh my
It was
goodness. Did the little one get wet? Did he felt
oh
pretty
yeah,
good about it?
we enjoyed it.
Okay, good, good, good. I'm glad you had a good time. I'm glad you had a good time. I had a good time. My family is still here. We got a full house over here with my parents. My nephews have kind of left out the house. My niece, her husband, baby, just a full house, full house. My youngest daughter had another basketball tournament, and I'm really proud of her. You know, she's in the 15U. She's 15 years old, and out of that really huge basketball tournament, Run for Roses, I'm talking about there were 22,000 participants, I believe, there, as far as spectators and active participants, 22,000. And she was ranked in the all conference 15U team. And I'm pretty darn proud because she works very hard. And so that was pretty exciting. Then I got a chance to hang out with some of my line sisters and have just some good social time. So fun times, fun times. And in addition to the fun times, as I mentioned at the top, I've had a lot of really good experiences and great conversations about some of these medical headlines. I was with Don Lemon during the outright live reading of the autopsy of Nolan Wells. So attorney Ben Crump presented the autopsy. And of course, the autopsy was done by Dr. Roger Mitchell, who is a renowned medical examiner, pathologist. He was actually the chief medical examiner for Washington, D.C. for 7 years. So brilliant. And we'll talk about that, of course, today. And then I also got a chance to go on Joy Reid to talk about it. And then today, and this is a treat I have for my members. Today, I actually had 3 appearances on News Nation, okay? The national news show News Nation, talking about cyclospora, foodborne illnesses. And I actually kind of slipped my camera in there to give y'all a little bit of behind the scenes. And so I'll be posting that today for my members. And for my top members, when I say top, I just mean the ones who are at the chief resident level. Today is our monthly live members only Q&A. If you're not a member, it's not too late. You can click the link in the description to join. You can always go to my one-stop shop, drfrita.com. But for the chief resident, that level, you get a chance once a month to meet with me after the show, and you ask me whatever medical questions you want to ask. What I provide is information. Of course, it does not replace your doctor's advice, but you can ask me about you. You can ask me about your mama. You can ask me about your sister. You can ask me whatever you want to ask, because I am Dr. Frita. For those who are new to our channel, we're very excited because we have over 1 million subscribers, and I am an MD. I'm a medical doctor who has been quadruple board certified. So I'm a board certified kidney doctor, meaning I'm a board certified nephrologist. I'm a kidney doctor and a high blood pressure doctor. I am also board certified in internal medicine. I am board certified in obesity medicine. And after I completed my Med-Peds dual residency at Georgetown University Hospital School of Medicine, I earned my board certification in pediatrics. So I love to learn. I read medical journals, articles every single day. That's not an exaggeration. And even more so than my love for learning, I love to share. If you come and you join us, if you subscribe, you will find that I have hundreds and hundreds of videos, and I present information in a way that's easy to understand, so that if you have a question about your health or a question about, going to the doctor, you're feeling concerned. If you watch my videos, it will give you some information so that you're armed when you go in with good questions to ask, and you can present yourself in a way where you won't be talked down to as easily. So it's really my goal to try to close that health disparity gap and to increase your confidence and ability to advocate for yourself, because you have the right to good medical care. So come on, join the party. And I thank you all for being here, including you in the replay crew, because yes, I see you. All right, so let's go ahead and get started. Let's open up. And I have something new going on today. We will be inviting people to the stage for a couple of segments. And I was thinking about just having you guys ask a couple questions about cyclospora, but I will give at least a few people a chance to ask some questions, or at least make some statements, even with the Nolan Wells story. So Shador, we can go ahead and put that link up when it's time. Once we put the link up for you to come up and ask questions, then it's going to say for you to give access to both your camera and to your microphone. Don't worry, please go ahead and give access, but as soon as you give the access, you can turn your camera off and we'll just have your voice up here. Okay. So don't worry if you're not Maybelline ready, In Vogue ready, whatever it is, just give access to both the camera and the phone, but turn your camera off, as soon as you give that access. All right. So let's open up, start talking about Nolan Xavier Wells and the preliminary autopsy results by the independent medical examiner, because as of now, we don't have the information from the primary medical examiner. Let's go ahead and first play this clip, and then I'll talk to you about what this autopsy means.
Tonight, newly released autopsy results are raising more questions about how Nolan Wells died. An independent exam commissioned by his family's legal team classified the cause and manner of death for the 18-year-old as undetermined pending investigation.
He's saying based on the examination of the body, he cannot rule out foul play. That is significant.
The forensic pathologist wrote there were no fractures, cuts, or bruises on Nolan's body, but noted red discoloration was found on the back of his head and needs more investigation. The autopsy was performed 4 days after his body was found. The pathologist also writing there were missing parts of the neck.
Have you or he asked anyone for access to those things?
Hopefully that the medical examiner will allow him to come and examine the throat, also to talk about.
Okay. All right. So I want you to, for this one, I'll have a few of you come to the stage. We'll just have a couple come to the stage. And in order to keep the conversation going on in the chat, you can answer this question in the chat as well. And I want you to give me, just give me a good old fashioned red heart. Just give me a love emoji, a heart emoji. And I want you to answer this question, because based on the results from the independent autopsy, the cause and manner of death of Nolan Wells is undetermined. It's undetermined. There's information that is missing. We know that certain body parts were withheld by the Mississippi medical examiners, and it has been reported that this is not an uncommon practice to sometimes hold back certain body parts to do more exams. But either way, there are key missing elements that prevented the second medical examiner, Dr. Mitchell, from being able to come up with a conclusion. So as of now, the cause and manner of death are undetermined. And so my question is this: what do you think should be done next in order to give Nolan's family the answers they deserve? What would you suggest that we do, since we've done the second autopsy and we still don't know? We don't know what's going on. All right. So Nolan Wells, this handsome, athletic, football-playing 18-year-old young man, on the 4th of July, went out with some friends. And initially, we thought that he was the only Black young man, because we saw him on the boat with 3 white males who were reportedly his friends. We now find that there were at least one other Black person there on the island. And so he left the coast of Mississippi to Horn Island, where there were a few hundred people reportedly. And when it was time to come back, Nolan did not come back with his friends. His phone came back, but he did not. And according to Nolan's mom, the friends did not tell Nolan's parents, that he wasn't back. They also didn't share that they had his phone. She had to track his phone down with Life 360. Also, initially at one of the friends' houses, Nolan's car was there. They had his car keys. And according to the father, initially he felt like there was some pushback and some resistance to giving him the keys. This is, was his interpretation. And so now, fast forward, when you look at Mississippi, the sheriff, Ledbetter specifically, very soon, right out the bat, he said, "Oh yeah, it looks like there was an accidental drowning." He said, "It's our understanding that Nolan chose to stay on the island." So he pretty much presented it that way, even before any type of investigation was done. So putting it out there that it was an accidental drowning, putting it out there that it was Nolan's choice to stay behind. But there's one issue that is not typical of a teenager or a young adult. Nolan didn't have his phone. Many teenagers won't even go to the restroom without their phones. And so that does not match typical young adult behavior, even according to Nolan's parents, to his mother. Also, she reports that on the Snapchat, there was nothing there. Snapchat will self-delete, depending on the setting, in 24 hours. She said even less than 24 hours, there was nothing on the phone. The phone, I must say, has not been examined by professionals yet. It will be, but I'm just expressing some of the feelings that Nolan's mother had, and what she felt did not match his typical behavior. The investigation will hopefully allow us to know what's going on. Either way, let's talk about this autopsy. The cause and manner of death by this independent autopsy, undetermined. There was a finding of a 12 by 8-inch lesion on the back of Nolan's head, and it was a reddish lesion. There was no fracture, according to Dr. Mitchell, the medical examiner, and we don't have the information from the brain to know if there was an intracranial hemorrhage, a bleed, a bruising, a contusion. We don't know that information on the brain. We just know that there was a 12 by 8-inch reddish lesion. That's what we know. So could that have been trauma? Could he have been beaten on the head? We don't know. Could it just be the pooling of the blood just from a post-mortem state after he passed away? Did the blood and fluid just go there? It's possible. We don't know. So it's undetermined. Also, one of the key questions was, did he drown, or was he already deceased when his body hit the water? There is a very easy way for medical examiners to determine that, and that's to look at the airways and to look inside of the lungs. Well, Nolan's anterior neck structures, meaning the structures in the front of his neck, did not come with the body. They were missing for the second autopsy report. By missing, I don't mean we don't know where they are. We know that they're being withheld by the initial medical examiners in Mississippi. And even according to Dr. Mitchell, sometimes that's customary to hold anterior neck structures back if you have more examining to do. Also, Dr. Mitchell said he doesn't know why they held them back. And so whatever information, at least at the time that this autopsy was presented, the independent one, we didn't know what the neck looked like. We didn't know if the hyoid bone was broken, if there were signs of asphyxiation. We didn't know if the trachea was disrupted. And very importantly, when you don't have the airway and when you don't have the lungs in a way that you can assess them, you can't properly assess if he drowned. If he actually drowned, there are ways that we could know. Okay. And I encourage you, I did a special live where I did a whole live Q&A on Nolan Wells. I did that on Thursday, on this past Thursday, which was the 23rd, July 23rd. I encourage you, after we finish this live, check that out, because I did that for almost an hour. And I go into the drowning details, how you can tell, how you can't. Bottom line, the second examiner didn't have enough information to know what happened to the neck, didn't have the neck, didn't have enough information to know if there was a drowning or no drowning. And, there's a lot that's still missing. And so my question to you is, what do you think we should do going forward? According to the medical examiner, it's undetermined until further investigation. What is the best way to give this family answers? Because they do deserve answers, in my estimation. So, Shador, if we can go ahead and put that link up, you all will see a link. You can click the link in the comments. And again, yes, give it access to your camera and to your microphone. But as soon as you finish that, take the camera off, take away the access, and we'll just talk and hear your question or comment about Nolan Wells' preliminary autopsy done by the independent medical examiner commissioned by attorney Ben Crump and his team.
All right, so the link has been shared, everyone.
Okay. In the meanwhile, for those of you who are feeling a little shy this morning, if you have that heart, and you have some kind of questions or comments, we'll take a couple of those until we see if someone wants to actually come up and speak today.
Absolutely. So member PJ.
Hi, PJ.
Hello.
Thank you for being a member.
PJ says they need to release the first autopsy report, and if they are holding it for further testing, it should have been noted when they release his body for the second autopsy.
Actually, I agree with that. And mind you, in saying that, I'm speaking from a physician's perspective. I don't know all of the ins and outs from the perspective of an attorney, of an investigation. If there's a reason you want to hold back information from potential suspects, to my knowledge, no suspects have been named, but if suspects were to arise, would you want to hold back details in order to measure who's telling the truth and who's not? I don't know that. And so, but just from a facts and wanting to know aspect, it would be nice to know the information, because there is definitely an advantage that the first medical examiner has over the second. They see the body when it's completely intact, right? They're able to observe the way that the skin looks, the organs look before it's ever cut or dissected or anything. And so, yeah, it would be nice for them to release the information from that autopsy, or at least for us to know why they're not. And perhaps for legal reasons, we can't be privy, but it still just puts us, and more importantly, the family, in a state of unknowing. And yeah, that's a bit unsettling, it seems, right now. Okay.
Yeah, and that seems to be the consensus, Dr. Frita, is
Okay.
release the first autopsy of the body parts.
Yeah, I would like that. And I certainly hope that we'll get an explanation soon as to when they're going to release them, when we'll know the preliminary results, because, the preliminary results usually come out, 24, 48 hours. And when they're checking for toxicology, as in substances, yes, that can take longer, but the preliminary, typically we'll see that soon. Okay.
The quiet threshold.
High quiet threshold.
Says keep demanding for transparency.
Demanding for transparency. So that's your answer to what the family should do, right? Because the truth of the matter is, no one wants to put their foot on the scale. It's not like, aha, smoking gun, I know someone did something wrong. Answers, just give answers. If there's no foul play, wonderful. If it's an accidental drowning, the way the sheriff department said, like almost immediately, then just let us know and give us the transparent facts of the initial autopsy, or let the independent medical examiner know. Facts, whichever way they go, foul play or no foul play, just give the family the information. Transparency. I agree with that. Thank you. Okay.
All right. Thank you.
All right. Maybe we'll take one more. And again, anyone who wants to actually come up, then we'll go ahead and we'll listen to your voice as well. And yeah, and again, for the live that I did on the 23rd, it was pretty neat because it was all questions that were asked. So it was literally a call-in show. So it was actually pretty fun. So for those of you who actually have, more questions or curiosity, people asked some really, really good questions. And I gave some very detailed medical information about autopsies, medical examination, and how these things go from a medical perspective. So make sure, again, you check that out. We'll put the link in here so you can check out the Nolan Wells autopsy live Q&A. Yeah.
All right. Miss Aileen has a question, Dr.
Hi,
Frita.
Miss Aileen.
And she was the first in the chat today as well.
Oh, yeah. That was my next thing. I was like, oh, shoot. Who was the first person in the chat? Thank you, Miss Aileen.
Miss Aileen says, Dr. Frita, based on the independent autopsy, what additional tests or reviews would you recommend?
Oh, based on the independent autopsy, number one, ask for the interior neck structures to be released as soon as possible. And if they're not able to release those, if the first examiner is not ready to release them because they perhaps are doing some other testing, I would ask for them to at least release photographs of the hyoid bone, the neck, the trachea, what the skin looked like. Release the pictures and take notes of what the first examiner thought. That's what I would want. I would want the lungs so that the independent examiner could see if there was a drowning. Is there a sign of water in the lungs, of foam, of diatoms? Because if Nolan had already passed away before his body was in the water, no water would have entered the lungs, right? No marine life would be present in the lungs because he would not have been breathing. And so there's key information that can be found. So I would ask that be released. I would ask that the brain and all information surrounding the brain be released so that the independent examiner could figure out, were there signs of trauma? Was there an intracranial bleed? Could a head injury be a potential cause of death? Again, we don't know the answer one way or the other. What we do know is that the independent examiner does not have and did not have all the information that he needed at the time of the presentation. So it all goes back to the T word, transparency. That's what I would ask for. Yeah.
All right, thank you. And then Tanya.
Hi, Tanya.
Tanya asked, do you think they're holding the initial autopsy back because there was foul play?
I don't know. And I really want to be careful not to speculate. And I can understand why you asked that question because I don't know why they're holding it back. The only thing like I mentioned, could there be a legal reason and that I'm not privy to, that we're in an investigation, you would want to hold it back. So I would hope that that's not why, but I don't know if that's why. In other words, we cannot rule out foul play at this time just because we don't have enough information. Transparency.
All right,
Yeah.
thank you. And then Eunice, I'll take this last question.
All right. How much, Eunice?
Eunice asks, is it possible for the second doctor to go to Mississippi to see it in person, the throat?
I would imagine if he were invited, he could. If they said, hey, we want to keep it here, we're running these tests, but you're more than welcome to fly to Mississippi, then hey, you're welcome to our facilities. You can examine and get your information here. So is it possible? Yes, it's possible. I don't know the protocols and if it's proper. That part I don't know. To be honest. But that's an excellent question. Yeah. So hopefully, things will be forthcoming and we'll get answers soon and the family will get answers. Very good. All right. So y'all, please go ahead and give us a like, give us a subscribe. When you give us a like and when you share us, like if you share us in your group text, share us in WhatsApp, share us in GroupMe, share us in your email, go share it on the mountain, then it lets YouTube know that we're here and we're presenting evidence-based medical information. And it really does help us to give this information to more people who are interested in living healthier, happier lives, or just learning more about medicine from an evidence-based perspective. All right. So, oh my goodness. I can't believe, yes, I can. We're still talking about explosive diarrhea on this good Monday afternoon because cyclosporiasis, that parasitic infection caused by the parasite cyclospora, is on the rise. And yes, we know that RFK Jr., the head of the Department of Health and Human Services, who, as I remind you, is not a doctor, is not a nurse, is not a nurse practitioner, is not a physician's assistant. He's not a medical person. He was asked a question in a press conference if he felt like the cyclosporiasis outbreak was under control. He said, yes, he felt like it was under control. He felt like we had a source. But in actuality, these numbers are still growing, cyclosporiasis in the United States. And though it does look like we believe we've narrowed it down somewhat to a source for one outbreak that's now affecting 9 states, the FDA actually is investigating at least 6 other outbreaks. So we don't have the sources, which means at this point, it's actually not under control. Let's go ahead and play this clip. And then I ask this question, and you can come up to the stage or you can, put it a different way. Tell me how you're feeling about the information you're getting from the government. Are you trusting the information that you're getting about cyclosporiasis? Why or why not?
There is new troubling information from the Food and Drug Administration about that cyclospora outbreak causes severe diarrhea for thousands of people across the country. The FDA now announcing they have identified a second outbreak. Scripps News senior national correspondent Jay Gray tracking this story for us from Dallas. And Jay, officials are fairly certain the first source was that lettuce, that tainted lettuce. What do we know about what just may be behind this second outbreak?
Well, the short answer is they just don't know. This new outbreak has only been identified in the last 24 hours. So the difficult and time-consuming process of backtracing to identify the source is really just now getting underway.
Federal health officials say they're investigating a new outbreak of cyclosporiasis, with the number of cases of the parasitic intestinal illness already at a record high in the U.S.
Yeah. Okay, that's good. Yeah. So just to give you the update, and if you haven't asked your question yet, give me a green emoji. If you already asked before I said green emoji, we'll try to pick it out and see and answer the question. Are you feeling pretty good about the information you're being provided? And also, this cyclosporiasis outbreak, has it changed the way that you eat salads or fruits or vegetables? I want you to share what you're doing. All right. Before the update, the number is now up to at least 11,500 confirmed and suspected cases of cyclosporiasis in the United States. You heard me right. According to the CDC, there are at least 4,173 confirmed cases, laboratory confirmed cases of cyclosporiasis, and at least 7,400 suspected cases in the United States. For that one outbreak that has been singled out, that has been traced to Taylor Farms iceberg shredded lettuce that was supplied by a producer in central Mexico. The Taylor Farms has done a voluntary recall. Initially, the outbreak affected 5 states: Michigan, Ohio, Kentucky, West Virginia, Indiana. But now it's expanded to 4 more states, now for a total of 9 states being affected by that particular outbreak. The 4 additional states are Illinois, Kansas, Oklahoma, and Pennsylvania. Well, that's just one outbreak. There are other outbreaks, at least 6 total, being investigated by the FDA. And then we also heard some news from North Carolina. They have identified at least 560 cases of cyclosporiasis in North Carolina, and they're believing that their source is cilantro, parsley, and lettuce. You see, and so it looks like there's not just one source of the cyclosporiasis. So we're not under control yet, despite what we're hearing. As a reminder, and I want you to listen, I have so many videos at this point on cyclosporiasis. Plus, once I post my News Nation from today, yes, I did an interview. I did 3 interviews, actually. I was on during the 6 o'clock hour, 7 o'clock hour, 8 o'clock hour on the national news channel, News Nation, with Nick Smith Jr. And yes, we were talking about cyclosporiasis, and you'll have more information than you probably ever thought you needed. Plus, look at my short form content right here on YouTube. But remember, cyclospora is a parasite, and it is found in human feces. So you know what that means. If it contaminates something, you know what the original source was. And when it contaminates, it's typically on lettuce or fresh produce like raspberry, basil, cilantro. If you ingest a food or drink water that's been contaminated with the cyclospora parasite, it will take anywhere from 2 days to 14 days before you get symptoms. Most people get symptoms in about a week. And the predominant symptom is watery diarrhea, oftentimes explosive, plus abdominal pain, bloating. The good news is that even though, according to the CDC, there have been at least 308 hospitalizations for this current set of outbreaks, there have been no reported deaths. So that's good. It's usually not life-threatening, but this number is growing. We typically only get like 3,000 cases a year, and now we already have at least 11,500 confirmed and suspected. One thing that's very important to note is that prior to the current administration, we had a surveillance system in place, the Food Net, which involved the CDC, USDA, FDA, where states were required to mandate and to do certain surveillance for pathogens, specifically 8 pathogens or 8, microbes, potential infections. One of those was cyclospora. Since July 2025, and with different cuts, of the CDC, different cuts, due to the DOGE recommendations, we now no longer have that surveillance system for cyclospora. We don't. And at the same time, we have this very huge cyclospora outbreak. There is a correlation, okay? There is a correlation, whether you say there's a cause and effect or not. So that's where we are right now. I'll see if y'all have any questions or comments about cyclospora. And again, if you want to come up for us to hear your question, then we certainly welcome that as well.
Absolutely. Dr. Frita, there are a couple of questions.
Okay.
One moment here. Okay, Cheryl.
Hi, Cheryl.
Cheryl says the triple antibiotics get rid of the parasite, so does it just have to run its course?
Well, for most people do tend to do okay without antibiotics. The thing is, it's not a fun okay. The typical infection might last weeks or even like a full month of watery diarrhea several times a day, 5, 10, I've heard even 40 times a day of watery diarrhea. And the problem with that is that you can get dehydrated, which dehydration can lead to kidney failure, and that can lead to being a life-threatening issue. And so if you do suspect that you have cyclosporiasis, certainly if you're having this diarrhea, if you're getting dehydrated, if you have symptoms for more than a few days, it's recommended that you get the antibiotic therapy. The antibiotic of choice is Bactrim. Okay, a course of Bactrim. Here's the issue. Bactrim contains sulfa. So if you have a sulfa allergy, then it is required that you have a different type of antibiotic or anti-parasite or antiviral. One of them, ciprofloxacin, Cipro, works. Also something called nitazoxanide, which is like an anti-parasite, antiviral. But the bottom line is, if you're having the symptoms, certainly if it's leading to dehydration or the like, then Bactrim is still the treatment of choice. Yeah.
All right, thank you. Next question is from Eunice.
From whom?
Eunice.
Hi, Eunice.
She says, right now I'm not eating any lettuce or bagged salads. Is there a question in regards to berries?
Is there a question about what?
Berries. Are berries okay?
Oh, let me just tell you. Ooh, Eunice, don't be mad at me. I don't make the medical news. I just deliver it, Eunice. So It is being recommended to avoid definitely the lettuce that has been identified, right? The Taylor Farms lettuce from Central Mexico in those 9 states. To be extra cautious, there are some recommendations as well that people avoid bagged lettuce altogether, at least for now. Although I will say at this point, the only bagged lettuce that we know that has been voluntarily recalled is the Taylor Farms, the iceberg lettuce. It is not being recommended that you stop eating lettuce altogether. I can understand, the concern. It's being recommended that you purchase your own heads of lettuce. Okay, take off the top 2 or 3 layers of the leaves and then thoroughly wash the other leaves. That being said, we know that washing alone does not get rid of the parasite. It might reduce the number. The only thing that gets rid of the parasite is actually heat. Okay, heating it up to 158 degrees Fahrenheit. But yeah, so that's the lettuce. You ask about fruits and berries. Well, historically, fruits and berries have also had cyclospora infections. This is not the first cyclospora infection. In fact, it's not even the first time that Taylor Farms specifically has been involved with the cyclospora outbreak. We know that fruits like raspberries can be involved. I mentioned basil, cilantro. I mentioned that parsley is being suspected. But yeah, fruits can also carry cyclospora. We have not identified any specifically for the current outbreak, but raspberries, that's one in the past that's done it, and other ones can do it as well. And the tricky thing about that is most people don't boil their raspberries to 158 degrees Fahrenheit. And so it just becomes a bit of a risk, right?
All right, thank you. And Mrs. TNT, hello.
Hello.
What are natural ways to get rid of the parasite?
So I'm glad you asked that, because I know that there are a lot of wellness gurus who talk about parasite cleanses and different drinks and different concoctions and ways that they can do a parasite cleanse. We have no evidence-based medical information to support that a parasite cleanse actually works. And so as far as the scientific evidence, here on the Dr. Frita channel, we deal with evidence-based medicine. The evidence we have is that Bactrim is the treatment of choice to actually get rid of cyclospora. And then when I talked about those other antimicrobials like the ciprofloxacin, ciprofloxacin does not work as well as Bactrim, but it can actually help to get rid of some of the cyclospora. But as far as natural ways and parasite cleanses, those have not been proven to get rid of cyclospora, not at least from any evidence-based scientific information that we have as of yet. Yeah. So if you're going on social media, let me be clear, and you see people saying, oh, all you have to do to get rid of it is do this and use bleach and peroxide, don't do it. Okay. Baking soda vinegar and all you have to do, don't do it. Okay. Wash your fruits and vegetables or boil your produce to 158 degrees Fahrenheit. That's the only evidence-based information we have. Please don't follow the wellness gurus because it could harm you. And if you see people saying, oh, just take this and drink this and do this oil of oregano and oh, this is magically, I'm not saying that those remedies will all hurt you. I'm not going to say that. But what I can say is there's no evidence to support those remedies. And I do suggest that you listen to evidence-based medical information. Okay, maybe take one more and then we'll keep it moving. Y'all make sure you give us a like and give us a subscribe. I'm very excited that we have over 1 million subscribers here on the Dr. Frita YouTube channel. We want some more. Let's just keep going. Ain't no stopping us now. Who sings that song? And make sure you follow me on all social media platforms. Listen, I put out a whole lot of short form content, and it often hits first on some of my other social media platforms. And sometimes I'll put things there that I don't put on. Different platforms have different information. So make sure you give us a follow on all things at Dr.Frita. And while you're doing that, while you're giving us a follow, listen, please go ahead and check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. I'm very proud of it. As I mentioned, I'm a board certified kidney doctor and high blood pressure doctor. And we know that high blood pressure is a leading cause of death, leading cause of strokes, leading cause of heart disease, second most common cause of kidney disease. And so, yes, I share my evidence-based medical information training as far as, treating with medicine, the traditional ways, but I also go heavily into natural, holistic lifestyle remedies using food as medicine. And most exciting for me is I have it available on Audible. Literally Audible. I have this book in Audible and it's in my own voice. So if you check my link, go to my one-stop shop, drfrita.com, go to Amazon, go to Audible, And if you're a member, just go ahead and use one of your credits and you can get my book, Under Pressure, A Guide to Controlling High Blood Pressure. And please give us a 5-star rating. I'm telling you, we're going to earn it. All right.
All right. Thank you, Dr. Frita. I do have one more question from Miss Linda.
Okay.
And she asks, if you take the antibiotics, what do you do to help your body to recover from the antibiotics?
Okay. So when you take the antibiotic, the most important thing that the antibiotic is doing is getting rid of the levels of parasite in your body, right? And I will say with every medication, there are potential side effects. For many people who are taking antibiotics, just as sure as antibiotics will kill bad bacteria or harmful bacteria, or in this case, interesting, yes, it's the antibiotic, but it actually does kill a parasite. The antibiotics can sometimes have a side effect of upsetting your flora, right? They can upset the natural flora in your intestines in some cases. In this case, the benefits are going to outweigh the risks as far as your gut. But even for women in particular, sometimes taking an antibiotic can throw off the natural bacteria flora of your female reproductive system, of your vagina, right? And it can increase your risk for yeast infections. And so make sure that you are paying attention to those things, talk to your doctor, recognize symptoms of vaginal candidiasis, yeast infection, and again, consult with your doctor, because what I'm giving you is information. It's not replacing medical advice. But I know that for my patients, if I'm giving them heavy antibiotics, I warn them of what can happen with their stomach. They might have a change in their bowel habits. They might have yeast infections. And I'll even treat my patients. I'll give them some anti-yeast medications like fluconazole or diflucan, things of that nature. But consult with your doctor, because you are correct. Antibiotics can have certain side effects, but the key is to be proactive, have open conversations with your doctor and weigh the benefits and the risk. In this case, if you're someone who's being dehydrated because you're having multiple watery stools a day, then more likely than not, the benefits of having an antibiotic like Bactrim to take care of it are going to outweigh any risks that it will cause in most people. Good question. Okay. All right. Thank y'all. We're going to move on to actually a game. We're going to move on to a game, myth versus fact. Please, y'all, make sure you give us a like. Even if you're watching us from your smart TV, please grab something where you can give us a like, be it your phone, your iPad, your whatever it is, your desktop, and give us that good old thumbs up. It really does help us here as we give you evidence-based medical information. All right. Myth versus fact. Real Housewives of Orange County. One of the stars, Jeana, 70 years old, shared that she thought that she just had a sore on her tongue caused by a tooth that wasn't really, doing what it was supposed to do. Maybe it was rubbing her tongue the wrong way. And then she actually found out that she had tongue cancer. And so this is what I want to do. I want to play this game of myth versus fact when it comes to oral cancer, tongue cancer. And then afterwards, we'll play the link about what Jeana of Real Housewives of Orange County went through. All right, myth versus fact statement number 1. All right, I've answered all the questions I'm going to answer for this first half. Now I want y'all to answer questions. Ain't no fun when the rabbit got the boop, boop, boop. All right, Shador, if you could read myth versus fact statement number 1, please.
Yes. Statement 1. A sore in your mouth that lasts more than 2 weeks is probably just a canker sore or irritation and does not need a doctor visit.
Okay, put an M1 if this is a myth, an F1 if this is a fact. A sore in the mouth lasting more than 2 weeks, not getting better, is probably just a canker sore. You don't need to worry about calling the doctor. Okay, M1 if that's a myth, F1 if that's a fact. All right, myth versus fact statement number 2, please.
People who do not smoke or drink are not at significant risk for tongue or oral cancer.
Oh, read that again, please.
People who do not smoke or drink are not at risk, not significant risk for tongue or oral cancer.
Okay. So if you're not a smoker, if you're not a drinker, you're not at significant risk. Is that true? Put an M2 if that's a myth. Put an F2 if that's a fact. If you're not smoking and drinking, you're not at, a really significant risk. Okay. Pencils down. All right. Who came to play, Shador?
Everyone, Dr. Frita.
All right. What y'all got?
All right. Statement 1. A sore in your mouth that lasts more than 2 weeks is probably just a canker sore or irritation and does not need a doctor visit.
Okay.
So we have Yolanda.
Hi, Yolanda.
Says it's a myth.
Okay.
Miss Rosamond agrees that it's a myth.
Hey, Miss Rosalind.
It's me, says a myth.
Okay.
Nikki agrees as
But it's a
well.
myth. Okay.
Member PJ says a myth.
Okay.
Shout out to member Miss Mary. Hello.
Thank you for being
She
a member.
agrees. It's a myth as well. Thought I saw a fact in here.
Okay.
Member Miss Sheila says it is a fact.
It's a fact that it's probably just a canker sore if it's hanging around, even if it's 2 weeks. Okay.
Member Dakala, hey,
Hi,
says a myth.
Dakala. Are you activated today, Dakala? I guess so. All right. It's a myth.
And member Miss Sarah says it is a myth.
All right. Thank you also to all my members. Thank you. And remember, if you're a member at the chief resident level, then we do have our live members only Q&A right after today's live. And it's not too late. You can go ahead, click the link in the description, or go to my one-stop shop, drfrita.com, to join, become a member. If you're at that chief resident level, you'll be a part of the monthly live Q&As. And at all levels, I have a really good surprise that I'm going to upload today of some behind the scenes action of me doing one of my live interviews on a national news show. All right. So the answer, drum roll, myth. It's a myth. If you have a sore in your mouth and it's lasting for more than 2 weeks without healing, you definitely need to have it evaluated. Bring it to your doctor's attention, your dentist's attention, whoever you have access to who's a doctor, and let them know that it's been in your mouth for 2 weeks and you want to have it evaluated. What happens is a lot of us are able to kind of make excuses that are possible and sometimes likely, but we don't want to play a guessing game with our health. And so if you have a lesion that's like reddish or a whitish patch, even if it looks like a canker, if it's there and even after a couple of weeks, it hasn't gone away, it's not healing, that is not normal. That is not normal. So if it's there for more than 2 weeks, it needs to be evaluated. Could it be a canker sore? Potentially, possibly, but you don't want to guess. Just like with Jeana from Real Housewives of Atlanta, she was kind of dismissing it, as many people do, and it turned out that it was cancer. Okay. All right. Myth versus fact. Statement number 2, please.
People who do not smoke or drink are not at significant risk for tongue or oral cancer.
I can't wait to see the answers here.
All right. Let's see. So we'll start out with some members here. Miss Andrea, hey.
Miss Andrea, day 1, what'd you say?
She says myth.
Wait, even if you don't smoke or drink, Miss Andrea, you think you could still get oral cancer? Interesting. Muy interesante. Okay, what else?
Shout out to Forever a King. Hello.
Forever King. Hello, hello.
Agrees that it is a myth.
Okay, so you think you can get it even if you're not a smoker or a drinker?
Miss Mary says myth.
It's a myth as well. All right. Hi, Miss Mary.
PJ agrees, a myth. Okay. Miss Sheila says a fact.
Sheila. You think it's a fact? You think it's those folks who are out there smoking and drinking down to the club, or having snuff on the porch in South Georgia? That's who you think is getting it. But if you don't live that life, you don't think you'll get it. Okay.
Remember, Miss Sarah says a myth.
A myth. Okay. You think you could still be at risk? Okay.
Eunice says it's a fact.
Miss Eunice says it's a fact. Okay.
Clarissa says a myth.
Clarissa. Okay.
And Zero says myth.
Zero says myth. Okay. Drum roll, drum roll. It's a myth. It's a myth. So I will say, and for those of you who said fact, I know where you were going with this, because it is true that the classic risk factors for oral cancer are excessive alcohol. Yes. Definitely tobacco use of any kind, whether you're smoking, whether you're chewing tobacco, doing snuff, anything, cigars, pipes, any type of tobacco use does put you at a high risk. That is for sure true. But there are other things that can put you at risk as well, including HPV infection, okay, human papilloma virus. And it can put you at risk for oral cancer, tongue cancer. It can also put you at risk for the pharyngeal cancer, that head and neck cancer. And we've talked about it here, where Michael Douglas shared that he had some oropharyngeal cancer or head and neck cancer due to HPV. And also Maria Navratilova, the tennis star, had shared that she had some head and neck cancer due to HPV. And so even though the drinking and the smoking will put you in a high risk category, if you don't drink, if you don't smoke, you still could get tongue cancer and oral cancer. And the importance of that message is don't sit there and rule it out and say, I have this sore. It's been here for, 3 weeks, but I don't drink, I don't smoke, I can't get it. Yes, you can. So just pay attention to your body. Let's go ahead and play that clip that talks about Jeana, the Real Housewives of Orange County, and then we'll keep moving. Give us a like, y'all.
Jeana Keough shares a heartbreaking health update. The Real Housewives of Orange County alum has been diagnosed with tongue cancer. In a newly created GoFundMe, her daughter Jeana Keough Bosworth reveals her mom first mentioned a painful spot on her tongue during a visit to Florida, thinking it was caused by a tooth. Writing, she paused and thought about it and realized it had been nearly a year. A biopsy confirmed our worst fear, squamous cell carcinoma of the tongue. Kara says the family was hopeful after Jeana's initial surgery, but when doctors removed lymph nodes, they learned the cancer had spread, explaining what we thought would be a one-time.
Okay. Yeah, and even in addition, so I mean, that's way beyond the 2 weeks, having it for a year. And so definitely, just it's not normal for a sore to be in your mouth, on your tongue. And so when we talk about like mouth cancers, we're talking about anything you see inside of your mouth when you open it. So all the skin lining your lips, your tongue, your gums, roof of your mouth, floor of your mouth. And that outer layer is made up of squamous cells. And in this case with Jeana, she had squamous cell carcinoma. She also had other complications. She had a blood clot, a DVT with infection, which delayed her being able to get her stomach tube. So she's had so many things. And so certainly praying for her well wishes and her healing. And I do thank her and her family for coming to the front, because we really don't talk about tongue cancer very often. And when we do, I do believe most people think that it's just people who use alcohol, just people who drink, but other people can get it as well. All right. So wishing her well. All right. So now let's move to our second weekly dose of the latest trending medical headlines and celebrity health news. And let's talk about someone whom I'm quite fond of, Nivea. Nivea is a Grammy Award nominated singer. And, we know her from songs like Laundromat, and she really is quite talented. And she's been in this business for quite a while. If you've ever seen her in an interview, there's something very transparent, something genuine, a certain warmth that you'll see. She was married to The Dream, The Dream. They have, I believe, 3 children together. She also has had a baby. She shares a baby with Lil Wayne. And so she's been in the industry. She has lived. And as I mentioned, I did get a chance to meet her when we were both on Sister Circle Live. Shout out to Rashawn Ali, to Selena Johnson, to Quad, all my people who were on that show, to Trina Braxton. That was a good time. We got a chance to be on that national talk show, Sister Circle Live. But Nivea was a guest there on the same day when I was a guest there doing my medical expertise commentary. And one thing I remember about her is that I enjoyed her interview very much with the ladies of Sister Circle Live, but also even just after the fact, it was very good talking to her. She was down to earth, and she just talked to everybody, anybody who was there in the crew. She just treated everybody with such humanity. I have to say that about Nivea. So shouts out to Nivea. Well, now she shares that she has been diagnosed with leukemia. And now, according to People magazine, she shared what type of leukemia she had. And it is CML, chronic myelogenous leukemia, also called chronic myeloid leukemia. And so I'm going to talk to you about CML. We'll talk about what it is, how common it is, who is at risk for it. And we'll talk about diagnosis and some of the treatments of it. But what I'm going to ask you to do, and I want you to give me a little drop of blood, give me a little red drop of blood. Tell me what you think some of the signs and symptoms of leukemia might be. So let's play this clip. I'll talk about it. And then MedHeads, give me a little red blood drop. What do you think some of the signs and symptoms of leukemia might be?
For right now in this moment?
Oh, my lamb. Well, first of all, I was diagnosed with leukemia earlier this year.
Really?
Yes. And I'm so grateful to God. Been going through treatment and everything is going great so far. And I expect it to continue. Amen, amen, amen.
Absolutely.
And I'm very grateful for life. It's so cliche to say, you don't know the time nor the hour, but it's true. And it just helped me put a lot of things in perspective, and I live in gratitude like religiously, and I'm just grateful for everything. Like I'm doing things I want to do. I'm definitely back into my music, and I'm going to school for audio engineering. I've always wanted to learn how to engineer and mixing engineer in particular, but in general, just doing all the things, honey, loving on my children and just being grateful and taking every opportunity that comes my way.
Don't y'all love her attitude? I do. She has literally at her young age been told that she has leukemia. And instead of trying to, wrap things up for final chapter, she's opening up new chapters, being positive, being grateful in the midst of everything. So I appreciate her for that. And remember, med heads, give me a little blood drop emoji and tell me what you think some of the signs and symptoms of CML might be. And now I'm going to tell you exactly what CML is. So again, CML, chronic myelogenous leukemia, is a type of leukemia, and it's actually pretty rare. It only accounts for about 15% of the leukemias. And when you think of people who are at risk, they tend to be older people, certainly over than the age of 60. She is in her 40s, 44 years old, I believe. Also, men tend to get CML a little more frequently than women. Another risk factor, radiation therapy. If you've ever been treated for a cancer previously with radiation, that could be a risk factor for CML. And then sometimes you'll have it and you won't even have any risk factors. Here's what happens. When we're talking about leukemia, and specifically CML, we're talking about an abnormal growth of your blood cells. And so inside of your bones, you have bone marrow, which is this like spongy tissue, and it's responsible for making your blood cells. You will often hear me talk about your red blood cells being produced by the bone marrow. Your white blood cells are also produced by the bone marrow. And typically when you have blood cells that are produced, they come out into your body, they do their good work, and then they end their life cycle and the cells pass away, apoptosis. It's the circle of life. Well, with CML, those blood cells aren't respecting the circle of life. What happens is there's a certain mutation and you get something called the Philadelphia chromosome, and it causes your white blood cells to grow, to replicate, to grow, to replicate. And instead of them respecting the cycle of life where their work is done and it's time for them to have their apoptosis, these abnormal cells keep growing, they keep multiplying. And then what happens is that these abnormal white blood cells actually start to bully and crowd out the normal cells, and they overtake your tissues, they overtake your body, and ultimately, if not treated, they can lead to you passing away. The thing about CML is that unlike some of the more acute, really aggressive, fast-acting leukemias, CML, or chronic myelogenous leukemia, is just that. It's kind of chronic. It can be insidious. It can be slow growing. And so oftentimes people who actually have CML won't have symptoms immediately. They can develop them, which is what we'll talk about. But sometimes you can be walking around with CML and have no idea until you go to your doctor just to get some routine blood work, and you find that your white blood cell count is out of control and you had no idea. And so you may be wondering, okay, CML, well, it doesn't run in my family, I'm good. Well, it normally doesn't run in families. Typically that mutation I talked about, that Philadelphia chromosome, oftentimes it'll happen after you're already born. You won't even inherit it. And I won't get into it too much, or will I? Okay, real quick for any of my science nerds out there, you know that it is typical that you have 23 pairs of chromosomes, which have your DNA, right? Well, in CML, that chromosome 9 and chromosome 22 actually do a little switcheroo, where part of chromosome 22 goes to chromosome 9 and vice versa. So then you get this long chromosome 9 and this little short chromosome 22, or Philadelphia chromosome, and that becomes responsible for creating a gene, and you then start to get abnormal production of tyrosine kinase, and that leads to you having abnormal production. But basically it's the Philadelphia chromosome. And 97% of patients with CML do have that Philadelphia chromosome mutation. Okay, so with that, I mentioned that oftentimes there are no signs and symptoms, but sometimes there are. And so med heads, what do you think some signs and symptoms of leukemia or CML might be? And I'll be honest, I don't expect y'all to really necessarily know this offhand, because like I said, CML is actually kind of rare. But y'all know, I think my med heads are pretty smart. Oh, real quickly. Okay, so my brother was watching the show last week, and he's a self-appointed know-it-all. He's pretty smart. but he was listening to the interaction that I have with all of you who are here. And he's like, I watch a lot of content creators and I listen to their audience's questions. He said that he's never seen or heard an audience smarter than mine. He said the answers to the questions that I ask, the comments that you all give, the information that you share, he said he's never seen an audience smarter than mine. And so that's just a shout out to the med heads, a compliment from my brother who he pretty smart himself. So yeah, so he sees y'all. And so I appreciate y'all for the participation. They know. All right. What do y'all think some signs and symptoms might be of CML or of leukemia?
All right. Shout out to member Miss Dietrich.
Hello.
She says fatigue.
Absolutely. Fatigue is one of the symptoms. Very good. Come on up to the front of the class.
PJ.
Hi, PJ.
Bruising, bleeding, and infection.
You got it. Easy bruising, easy bleeding, and suppression of the immune system, right? And so you can have an increased risk of infection. Absolutely.
Miss Rosalind.
Hi, Miss Rosalind.
Weight loss, fever, chills, and loss of appetite.
Come on to it. So an unintentional weight loss, you can get an early satiety, meaning you get full fast, okay, which of course would contribute to the weight loss. Certainly you can get fever, you can get the chills. Yes, all of these can be symptoms and signs of CML. Good.
All right, Nick Nack, hello.
Hey, Nick Nack, welcome back.
Nick Nack adds pain and weakness.
You can definitely get pain, specifically bone pain. Also, some patients with CML describe a pain or pressure in the left side of their abdomen or chest, right under the rib cage where the spleen is. Okay, so you can get bony pain and you can also get a specific pain where the spleen is located. Very good.
Jackie, hello.
Hi. Oh, listen, Jackie be in the mix. Okay, how you doing?
Jackie says weight loss.
Absolutely, weight loss and specifically unintentional weight loss. Very good.
Miss Yolanda added pale skin.
Yes, pale skin. So I mentioned that these white blood cells will start crowding out normal blood cells. What if you have normal red blood cells that can no longer proliferate and grow the way that they're supposed to because these doggone CML cells are big? That can make you anemic and it can lead to pale skin. Very good. You come on to the front of the class, Miss Jackie.
All right, and we have newest member, Miss Zelini. She says, isn't that some of the same symptoms as lupus?
I'm glad you said that. Listen, and thank you for being a member. Later on this afternoon, I want you to check. Look, I have so many members only videos for you to see, but I'm going to put one in particularly today where you'll be able to see where I was doing an interview. And I'll just go ahead and give you the heads up. There was someone with lupus who had cyclospora. And at first she didn't think she had cyclospora because she said sometimes she gets upset stomach and has symptoms with lupus. And so to your point, lupus, doggone it, is that great imitator. And the same symptoms that I'm mentioning, fatigue, pale skin, bone pain, all of these things, suppressed immune system. Yes, these can all happen with lupus, which is why it's important. If you're having symptoms, then you go see your doctor, because the way that your lab work would look if you have leukemia versus lupus would be different. Very different, right? And so, yes, sometimes you can't pinpoint just on symptoms, but you do know when something is not right with your body. And that's when it's important to consult with your doctor. Excellent point. And thank you for being a new member.
All right. Thank you, Dr. Frita. Thank you, Miss Celine. And then you somewhat hit on Miss Sheila's question.
Okay.
She says, is there blood test to check for this cancer?
Absolutely. Absolutely. And so, and like I said, we mentioned all of those great signs and symptoms. A lot of times people won't have any signs and symptoms and they'll get their blood work and they'll have like extremely high white blood cell count. So typically you might expect the blood cell count to be between 4 and 11,000. It'll show up as the number 4, anywhere to 11 on your blood work under WBC's white blood cell count, but it might, be 80,000, 100,000, just something extremely high if you have CML. Also, and Nivea talks about this, bone marrow biopsy or aspiration. And she ended up having to have 2 because the first one didn't give them the answers. But the physician will actually get a sample of your bone marrow to look at the cells and see if you have these abnormal cells. There's genetic testing as well to see if you have that Philadelphia chromosome mutation I mentioned, because again, 97% of people with CML have that mutation. So yes, there are very definite tests to do, but if you're just going and doing your routine blood work and just getting a CBC, complete blood count, then that can sometimes pick it up. And that's often an early way that it's picked up if you don't have these severe symptoms. Great question. Good. All right. Is there anything else I wanted to say about CML? Oh, just treatments. She was happy that she didn't have, she was not in a blast crisis. So at least from at the time that Nivea shared, she did not need chemotherapy. The most common treatment for CML when they're able to catch it is TKIs, tyrosine kinase inhibitors. If it progresses or mutates or is not responsive, then some people might need other treatments, like even stem cell transplant or autologous bone marrow transplant. But for many people, they respond to TKIs, tyrosine kinase inhibitors. All right. So thank y'all. So I hope y'all were able to learn something about CML. And if you were, then we can all sit here and thank Nivea, because if it weren't for her being transparent about what's going on in her life, probably a lot of us never would have really thought about CML, or maybe we would have thought of it as just that person's disease over there, that, person who's, way older than perhaps you are, or that person who just, has it in their family. But now, you don't necessarily need a family history, and you can be a young, successful, beautiful mom and singer, and it could still happen to you. All right. So who wants to live a long time? Who wants to live a long time if they have a good quality of life? I know I do. Well, apparently so does Arsenio Hall. So let's go ahead and close this thing out on a positive note, and let's talk about how we can have good, high qualities of life. Arsenio Hall is 70 years old. He looks much younger than that. He shares his secrets, but what he says is his secrets are not necessarily evidence-based medicine secrets. So we're going to share his story, and then let's talk about longevity. Let's play that clip.
You mentioned in the monologue, you used the term death pants.
Yes.
And so we were laughing about that. Yes, and my son.
Those look like some death pants.
Yeah, he took me to buy some death pants.
And you better be careful. We need you.
Don't you die. Dude, don't you die. We need you. When you're 26 like my son, you can wear these, but when you're 70, these are death pants.
First of all, no. Let me tell you something, Mr. Arsenio Hall. You don't look like anybody's 70. What are you doing?
Oh, smoking weed.
Oh my gosh.
Yeah.
My brother, we first met.
Okay. So that's his secret. The opinions and information provided by Arsenio Hall are not those represented by the Dr. Frita show. However, that's where he stands on it. That's his secret to youth. I'm going to talk to you about some Harvard-based evidence on some secrets to longevity, living a longer quality of life. Plus, I'll talk about a little bit of evidence from the Journal of the American Medical Association, JAMA, about longevity. And I want y'all to go ahead and put in the chat as well. And give me a tree. Give me a tree emoji, right? Don't trees represent life? Anyway, give me a tree emoji and tell me some of your secrets to having a long, good quality of life. All right. So according to an article written in Harvard Publishing talking about secrets to longevity. First of all, I know that a lot of you are on different social media and you see people pop up and they tell you about all these different expensive treatments. They'll tell you about NAD. They'll tell you about all kinds of, going into ice baths. They'll talk to you about just stem cell treatments. They'll talk to you about all these different longevity practices, which can cost, thousands or tens of thousands or even hundreds of thousands of dollars. And quite frankly, for the average person, these costs are not feasible. That's okay. I don't want you to think that just because you're not able to go into a hyperoxygen machine, or if you're not able to afford it, I don't want you to think that you are doomed to have a short life with a poor quality. You're not. And I'm not speaking on the pros and the cons of those things. I'm just going to talk about the evidence of some tangible ways to have longevity that is supported by the evidence. Okay. So, hey, this is some good news. Now, for one thing, I'm not even going to tell a lie. Having a family history of people who live to be octogenarians or living over 100, having that family history, genetics, that does play a role. So don't let me pretend like it doesn't. But there's more to it. There's still things that you can do with your lifestyle to help you to have a long life. And so let me hear what you all say, and then I will co-sign when it's applicable. What do they say, Shador?
All right.
Y'all make sure y'all give us a like. Y'all know we're giving y'all some good old information here, and I'm having some fun. I hope y'all are.
BK Health, Dr. Frita, is one you preach a lot. Staying away from stress.
Absolutely. Very good. Come on to the front of the stage. And I know it's often easier said than done, but finding ways to manage your stress, leaving the house, 15 minutes earlier than you think you need to leave it, learning to control what you can control instead of just ruminating and obsessing over things that you can't do anything about. Try to focus on controlling what you can control. If there's a job that is not serving you, if you're able to get away from it and still, maintain a lifestyle that you need to maintain, get away from that job. If there are people who make you feel bad, if they take your energy down, if they're toxic, even if they're blood related, you'll have to find a way to not allow them to disturb your peace if they're causing you stress, because we know that stress can increase cortisol. Cortisol can tighten your blood vessels. Tightened blood vessels can lead to high blood pressure. High blood pressure, leading cause of death, as I talk about in my book, Under Pressure, A Guide to Controlling High Blood Pressure. Check it out. Get it on Audible. I'm not playing. There's really some really valuable information in that book. So very good. So avoiding stress can help you to live a longer life, longevity. Yes.
M. Johnson.
Hi, M. Johnson.
The diet route. No meat, milk, cheese, wheat, and sugar.
Boom, boom, boom. You're onto something. And this was actually covered in JAMA, Journal of American Medical Association, where some women who followed more of a plant-based diet, which it sounds like you're describing, had a 23% lower chance of having premature death than people who did not follow that diet. And this is just one study, but what they looked at is for those women, they followed diets that were close to the Mediterranean diet, where they had olives, olive oil, lettuce, fresh fruits, fresh vegetables. And for the ones who did eat meat, they tended to eat fish, like grilled fish. So you didn't have to necessarily be a total vegetarian, but most of the diet for these women with the longevity, most of the diet was plant-based. And so we do have evidence to support that if you have a mostly plant-based diet or a Mediterranean diet, then you are more likely to have longevity, at least based on some of the science that we have. Very good. You come to the front of the stage. That's good.
All right. Thank you, Miss Rosalind.
Hi, Ms. Rosalind.
Says laughter, walking, eating right.
According to this Harvard study, socialization. And so that's what gets into the laughter. When you're socializing, when you're laughing, when you're having human connection, that's believed to help with longevity. And in that same study, they also mentioned exercise. According to the American Heart Association, for most adults, it's recommended that you have 150 minutes of moderate exercise in a week. So that might be like 30 minutes of exercise a day for 5 days, or 75 minutes of high intensity exercise, or a kind of a comparable kind of mixture of both. And yes, the exercise is believed to be associated with longevity, a longer life, and a good quality of life. Y'all got these. Good. What else?
All right. Dakala.
Hi, Dakala.
Stay away from negative people, including family members.
You see, Dakala activated. We're already on the same page. That's what I was saying. Stress, even if it's your blood that's causing stress, find a way to not let people drain your energy and bring you down. If they don't serve you, then yeah, sometimes it's family as well. Certainly relationships, might be spouses. Okay. You might have to go no contact for longevity. Very good.
Yolanda, eat healthy, exercise, increase water intake.
Hydration. Yes, go ahead.
Limit consumption of alcohol, take vitamin supplements.
Okay, good. Now, in this one, they did not specifically mention vitamin supplements. I'm going to talk about this real quickly, some of the supplements that we do have evidence for. But yes, the exercise that was mentioned in the studies, the eating healthy that was mentioned in the studies, the low stress that was mentioned, hydration, specifically hydration was mentioned as well. Consult with your doctor to find out what the proper hydration is for you. For many people, between 2 to 3 liters of water a day. That's assuming that you don't have heart failure or lung disease that might, cause you to need a fluid restriction. For some people, half of their ideal body weight in pounds might be the right water. Consult with your doctor. As far as vitamin supplements, this is just a reminder. When you see supplements like online or by wellness gurus, if they're not FDA approved, it is difficult to know everything that's in them because people can have proprietary blends or secret blends. And so make sure you consult with your doctor. I'll tell you some of the vitamins where we do have evidence to make sure they're repleted. Vitamin D. Okay, make sure your primary care doctor checks your vitamin D level, because we know vitamin D is not only great for helping you to have good, strong bones, it helps you to absorb calcium in the gut, but we know that it's also associated with a better immune system. Some people, especially if they have nutritional deficiencies or rapid weight loss, might get a thiamine deficiency, vitamin B1. So you want to make sure that that's replete. Vitamin B12, you want to make sure that that is replete, because if you're below vitamin B12, yes, that can cause you to have an anemia, specifically a macrocytic anemia, but also low vitamin B12 can be associated with brain fog or forgetfulness. And so my point is, before just buying random vitamin supplements like online or from wellness gurus, consult with your doctors so they can do a breakdown, perhaps similar to the one I did, where you know which vitamins need to be checked to help with your longevity. So thank you. Come on to the front. Look, the front of the class is getting crowded. Where am I going to sit? Okay, what else? Let's do a few more.
All right, this is from member Miss Sarah. She
Hi, Miss
says
Sarah.
breath work.
Okay, let me tell you, I know where you're going, Miss Sarah. Breath work, as in like slow, deep breathing, meditation, right? Let's start with breath work, alternate nose breathing. Listen, check out my video that I have on top 10 exercises to lower blood pressure naturally. I talk about some of that breath work, alternative nose breathing, slow, deep breathing. We know that slow, deep breathing is good because it can help decrease stress. And we already said stress can mess with your longevity, right? When you do slow, deep breathing, that causes your heart rate to slow down, blood vessels to dilate. It lowers your blood pressure. Also, in that breath work, especially if you're able to combine it with meditation, we know that that can decrease stress as well. Again, decreasing the stress can help with longevity. So I like that. So you come on to just find a seat up here at the front of the classroom. Just find someplace to sit. Come on. Who else?
Ms. Pamela added water aerobics and no red meat.
Very good. Okay, so that gets to the exercise, and that was supported in that Harvard Publishing article. And then the no red meat. Now, I'm not going to say if you eat red meat, then you're all about to fall out and not have life. Let's just go with the evidence. Again, the diet that was studied in that JAMA article I mentioned, that was Mediterranean diet, where they were mostly dealing with plant-based foods. And if they had meat, it was mostly fish. Okay, and that's how they studied it. We do know that with red meat, the more red meat you consume, the more likely you are consuming cholesterol, okay, and some unhealthy fats. So if you eat red meat, then make sure that you're eating more of a lean meat, like instead of a fatty ribeye or something that has a lot of saturated fat, perhaps more something like a lean sirloin. And I definitely would limit it if you don't eliminate it from your diet. But very good. Yeah. Okay. Couple more.
We're here from Life Spark.
Hi.
Life Spark says meditation, prayer, contact with friends and relatives, baths, and then walking.
Very good. Yep. All those things that we've been talking about. Yep. You're in there. I agree. Yeah. Okay. Okay. That's good. So we had a jam-packed show today, and we're about to members, stay with me. If you're at the chief resident level, we're about to do our live members only. So stay with me. Stay with me.
We have a new member I want to shout out, Dr. Frita.
Oh, welcome, welcome. Listen, y'all, come circle back. Put your notifications on for my members. And members, just make sure you're subscribed. I feel like you are, but just double check, because sometimes people get kicked off of subscribing. They don't realize it. So that once I do post this members only video today, you'll get the notification. It's pretty fun. Like I said, it's behind the scenes of what's going on. Also, I want you to check out, I did an interview, a conversation on just this Friday on the 24th with Kempire. And you're familiar with him. He's a friend to the show. He's been on our panel when we were talking about was she fast or was she groomed? And I go over there and I do medical hour. And it was a really, really good medical hour. We talked about some of everything. We even started talking about PrEP. We talked about menopause. We talked about manopause. Do men have menopause? We talked about eye health. It's just a really great wealth of information. So check it out on Kempire. Plus, you know, he comes over here sometimes. Just really good conversation. And again, if you didn't get a chance to see it, right here on the Dr. Frita YouTube channel, I have a collaboration with Don Lemon from when the autopsy results were read. On Wednesday, July 22nd, I give my gut reaction. Okay. One no studying or go looking up anything. I give my reaction immediately after the preliminary autopsy results from the independent autopsy performed by Dr. Roger Mitchell. You don't want to miss that either. And I will be posting the Joy Reid interview on that same day, talking about the autopsy. And stay tuned. I'm also going to be posting my 3 appearances on News Nation that I had today talking more about foodborne illnesses, specifically cyclospora. So as we head out, make sure you give us a like, give us a subscribe, share this information. I have a new video that's going to be dropping soon. Make sure you check out the video that we dropped here on the warning signs of heart attacks that most women miss. And I've got another one that's coming up. Ooh, spoiler alert. Should I tell y'all? Ooh, should I tell you? I'm going to tell you. I'm not going to tell you. Okay. Just stay tuned. Y'all put the notifications on and you'll know. Members, I'm going to tell y'all. All right. Thank y'all.
Members, really quick, Dr. Frita. Hope she's joining us today. Ms. Rosalind. Rosalind's a new member to us.
Yeah. Oh, we got a day. Well, thank you for being a member. We have a wealth of videos. We have members only live Q&As. We have a good time here. I thank you so much for being a part. I really do appreciate you. I know for my members, for all of you who give us your time here, I appreciate you, especially, when you come and you interact and you help to make this interaction better for everyone by your personal experiences and your personal wisdoms. And for my members, I know that, in these days, you definitely have your choice of where you spend your resources. And so I appreciate you for the support of feeling worthy for you to spend your resources and your time with me here on the Dr. Frita channel. And I certainly do try and hope that I do give back to you. So I appreciate you, members, very, very much.
All right. And shout out to Barbara Joy.
All right. Welcome, welcome. And thank you. Thank you.
All right. We'll see y'all Chief Med Heads in a few.
All right. Thank y'all. Thank you for making Monday your healthiest day of the week. This is Dr. Frita Live. Signing out.